Hi everyone, welcome to this presentation, a healthy campaign of fighting Ebola. I am Nasanga Mary, and I'll be sharing with you about the Ebola virus disease, EVD, how Ebola is affecting the people on the continent of Africa. Ebola is a rare but terribly killer disease, and we need to take much care. We're going to talk about its background and a little about the research that has been found by scientists. We'll get to know how it spread, the symptoms, and also how we can prevent it from our families and communities. Let's get started. First of all, a little background about Ebola. It is a virus, and it is caused by a group of viruses that can get into your body and make you terribly sick. The research that I found on the CDC website reports that Ebola was first discovered in 1976 in a certain village near the Ebola River in the Democratic Republic of Congo. That's where Ebola originates its name, Ebola. And since then, there has been several outbreaks in different African countries. Additionally, scientists suggest that this Ebola virus existed long before the recorded outbreaks. Scientists also believe that Ebola is animal-borne and spread through certain animals such as fruit bats, chimpanzees, and monkeys. And if you get in contact with such animals, you can get sick, and this can lead to Ebola outbreaks in humans. I just want to share with you a short story about a recent outbreak that happened in Uganda in September 2022. It was on the 19th of September 2022 in Moene district of central Uganda, and health workers reported that they had started getting very sick patients with signs of bleeding, fever, vomiting, and headache at the hospitals, and they raised a concern that a sample was taken from one of the patients for further testings. Later, in the day, it was confirmed that the patient was positive of Ebola, and the news followed a declaration of Ebola outbreak in the country on the 20th of September. And as soon as the outbreak was declared, an action was taken to contain the spread. For example, the World Health Organization offered help with Ebola treatment kits, and also the response team worked freshly and tirelessly to help people and to stop the spread. Ebola comes with various symptoms, and the disease does not spread until these symptoms do manifest. Let's get a look at these symptoms. First of all, Ebola spreads through contact with blood and body fluids, and it circulates through humans and non-human primates such as fruit bats, chimpanzees, and monkeys. And Ebola has these symptoms may include, at an early stage, may include headache, high fever, chills, and joint pains. And if there's no medical attention, they can advance to the disease can become severe and advance to stomach pain, diarrhea, vomiting, red eyes, and nausea, and it can also lead to death. Although it's terribly a killer disease, there are preventive measures always that we can practice to make sure that we are safe and that our families and communities are safe. Let's take a look at some of the preventive measures. Prevention is better than cure. We know that it's better to prevent something from afar than waiting for it to happen on your health. Avoid body contact with blood and body fluids such as saliva, sweat, vomit. And to breastfeeding mothers, if you're infected, don't breastfeed because you can pass this on to your baby. Also, avoid having unprotected sex, especially with a person who is infected with Ebola or with Ebola. Remember, you can contract this disease through semen or vaginal fluids. And if you've gotten any of these symptoms, headache, fever, you have internal bleeding, you're vomiting, or you suspect anyone with such symptoms, don't hesitate to report such cases to a nearby health center, care center. And there has been Ebola virus vaccines that have been developed. So if the vaccine is available, please take it. Vaccines do help protect our bodies from such diseases. And more of the preventive measures: avoid eating raw bushmeat, as this may be meat from infected animals, and it could make you terribly sick. So be cautious about that. Use personal protective equipment when handling Ebola cases so that you can protect yourself and your loved ones from the virus. And this marks the end of our presentation. There's more that you need to learn, and you should visit these websites, the www.prevention.com. You can access more information about Ebola prevention and risks and preventions. You can also visit the www.cdc. There's also information that you can learn about Ebola. Thank you, and please do take care.